Good morning and welcome to this video about healthcare in Portugal. My name is Nick Robinson. I've been living in Portugal since 2001 and we built a company called Algarve that helps people relocate to Portugal. And obviously healthcare is a main concern for a lot of people. So now healthcare generally is really good in Portugal, and there's these two basic big systems. So there's the public system, which is essentially free. You pay a nominal fee to get in, but it's essentially free for all residents and non-residents as well. And then there's the private system, which you can pay with. You can get some medical insurance. Generally, like for example, my family, we pay about 250 euros a month. There's three of us, and we're sort of 55 plus. So that gives you a little rough idea of how much we pay for it. And then when we go to the actual private hospital, we spend about 40 euros for a consultation with a doctor. And some of the scans and things, I couldn't believe an x-ray the other day was like 2 euros or something. It's incredible. So it's really quite cheap. We do get a little bit more into the pricing and stuff as we go in, because I'm going to be interviewing Jorge Santos from the Lolé Hospital, the Lolé Hospital Group, and he talks a little bit about some basic procedures and how much they cost, etc. So there's a lot more detail involved in that conversation with him. But I just wanted to mention to you the basics, the overview, and I made a map all about listing the 16 private hospitals and clinics all throughout the Algarve. So wherever you are situated or wherever you'd like to be living, you'll be able to find that there is a hospital fairly close to you or a clinic close to you. And also please, on that map, if there are any that I've missed out, just let me know in the comments and things, or the comments of this video, and I'll happily add it and edit it and change it up. Okay, so let's have a chat with Jorge Santos. But just before we do that, I'd just like to say, if you do have any questions that are very personal and particular to your situation, please don't hesitate to get a hold of us on algarveaddicts.com/contact. Just drop in your email and a little note, and then we'll be able to try and find someone. If we don't know the answer, we'll find a professional who can, because we know quite a few people. And also, if you are looking for medical insurance and need some help, we work with a broker. And the nice thing about a broker is that they can choose the right medical insurance for you, and you're not getting pushed into medical insurance by the medical insurance people, because obviously they're obviously financially motivated. So I hope that helps, and I hope this can provide a landing point or a launching pad for you to explore the healthcare of Portugal. All right, let's chat to Jorge Santos. Hi, Jorge. Thanks so much for joining us. It really is fantastic to speak to you guys, obviously directly from the hotel group, from the hospital group, not the hotel group. That was another podcast, yeah. So, Jorge, if you could just tell us a little bit about yourself and your position with the hospital group.
So, my name is Jorge Santos. I work for my main function. I'm one of the partners of a private equity fund that currently owns several healthcare units in Portugal. We are the majority owner of Hospital de Lolé and their clinics in Algarve, and I'm also part of the management team of the hospital. So I'm not on the day-to-day management of the hospital, but involved in the strategy and the development of the hospital and the services it provides.
Excellent. And you've had quite a lot of experience speaking with American clients, is that correct?
Yes. So our fund, we've raised capital mostly mainly on golden visa investors, and considering the type of fund we have, we had a lot of interest from US citizens looking for the golden visa opportunity in Portugal. And right now we have roughly 230 investors. Close to half of them are from the US. So it's we've spoken with a lot of American investors, clarified a lot of questions regarding the healthcare system, because it's quite different from the one that they have in the US. Mm-hmm. And but it's been an interesting ride.
Well, that's a perfect segue to go into my first question. Is basically, could you tell us the difference between private and public health systems in Portugal? Because obviously there's a lot of differences.
So, considering you have across Europe, you have several types of healthcare systems, but mostly you have two types, and the US is kind of a different system, because the US is a fully or almost fully private almost fully private system. Our case, we have a very close system to the one in the UK, so we have a public and a private system that coexist in the same environment. The public system, it's quite easy to explain. So this is a fully national network with hospitals and primary care that's funded by taxes, and that it grants universal access. Whether you're a citizen or not, you have access to the public system. It's not exactly free. You have to pay some utilization fees, but they're relatively insignificant compared to what you usually have as the price of the service. On the private side.
Sorry, can I just jump in there quickly, George? Sure. So you're saying that even if you're not a resident, you can still make use of the hospital?
Yes,
okay.
Exactly.
I was always under the impression that it was...
What happens is that in some cases, there are some systems in place. For example, the European health card that simplifies the whole process. But in case of need, especially on urgent care or emergency, you always have access to the public. Meaning that if you're a foreign citizen, coming to Portugal and you want to schedule an elective appointment for a specific pathology, that's a little bit trickier. But if you have an accident or you fall or you have a heart problem, the ambulance will take you to the public, and the services will be provided, so no one is denied from healthcare services in case of emergency needs.
And that's fantastic, and they're not going to sit there and let you bleed while they wait for your credit card. They'll fix you
exactly.
up. And
so you don't have that issue. It's not. The system has the public system has a relatively good coverage. What you have is that since it's a small country, you have probably the high complexity hospitals are concentrated in Lisbon, Porto, and Coimbra, the three main cities. Then you have what we call a second tier or district hospitals that are more focused on elective care, what we call proximity care, but they still have emergency departments that can deal with trauma, appendicitis, that type of need. And then there's a network of primary care that, it has been declining a little bit in terms of access, but it still provides some service to the local communities.
And are those called extensão saúde? Those?
Yes, exactly.
Exactly. Okay, as opposed to the central saúde, which is the next level. Yeah. Okay, and sorry, I interrupted you. You were talking about the private.
Yeah, on the private side, what you have is there's a huge presence of private offer in the market. You can probably divide it in three main groups. You have healthcare groups that have hospitals, clinics, diagnostic centers, provide kind of a full range service. And here, hospital, and I can use the example of Hospital Loé, but for example, hospitals here in the sense that these hospitals are kind of a one-stop shop where you have a lot of outpatient care, so it's not just surgeries or inpatient and staying in hospital for 3 or 4 days. You have a lot of consultations, a lot of exams, lab tests, emergency care. So you have kind of one place where you can go for anything you need in terms of healthcare. Then you have clinics, more proximity based, and then you have a significant group here, which is you have some groups focused on providing diagnostic, meaning mostly lab tests, imaging, and some endoscopic exams, where you have large chains that provide that. And then you still have a market that's been declining because of the expansion of the large groups of private offices. The cardiologist that has its own office, the dermatologist that has its own office, more based on their own name, on their own brand, but things have been moving a little bit away from that and more into large infrastructure with capacity, with technology, and with knowledge, and also with brands that are becoming recognizable and that are a synonym of quality and good service. Because the interesting part in Portugal, and that's the main difference, for example, versus the UK, is that this system has this type of double. You can go to both sides. You can go to the public. You can go to the public, and it's a system that's very balanced, meaning that the public has 55% of the market, 45% on the private. So the private has a lot of weight, and you have a lot of coverage. Right now, it's hard to find a place in Portugal where you don't have a private hospital or a private unit that's less than 30 minutes away from where you are.
And it's quite interesting. Often the doctors who will practice in the public hospital, and then later in the week they'll go into the private hospital and offer.
Yeah, exactly. So that's one of the things why that's one of the main aspects that justifies how the system is balanced, is that doctors don't have exclusivity. It's something that has been widely discussed in Portugal regarding exclusivity for the public system. It's very hard because for the doctors it's economically much more interesting to work in the private, but clinically they also enjoy the complexity of the public, meaning that in the public they get a wide range of patients. In the private, with insurance and with the question with the issue that you need to pay for it, it kind of narrows down the range of people you look at, you see in the consultations, in the surgeries. But you have a lot of doctors work in the public, work in the private. More and more you have what we call more differentiated doctors moving more time into the private, because the market has also been growing a lot in the private, so they start to get interesting volume in the private only. But it's still a very balanced, meaning that you can go to a consultation in the private and find the same doctor in the public hospital. It's perfectly normal. I've
seen it myself. And how about languages? Like, because I always feel that obviously in public hospitals it's much more difficult to speak English, and in the private hospitals you can speak English. Is that 100% true?
Yeah, usually at the doctor's level, I would say that I would say almost 100% of the doctors, except like very old doctors that don't speak English, but most of the what's currently the existing generation speaks English, and some of them may have a little bit more difficulties in terms of conversation, but I would say that at the doctors and nurse level and nursing, I wouldn't say there's a difference. You probably find some difference in the ancillary staff, meaning the administrative staff,
and the reception.
The private makes that selection more carefully in terms of the people they hire, and they end up making that a prerequisite to have the person working for you. And especially in places like, for example, Algarve, you need to have people speaking English, and in some cases it's even useful if they speak German or other languages. But because that's something that it's very important, and I like to stress that, because the growth of the private in Portugal was several years ago. It was a growth driven by access, meaning that people were waiting a lot of time to get consultations and services in the public, and this started to drive the private, because you would get a consultation next week or a surgery in 2 weeks. So that was the driver back then. Right now it's a service driver. People became more of a consumer, so they tend to choose where they are better treated, where the facilities are better, where with the hospitals that have better technology. And so it's no longer, people gain a lot of power. It's no longer, if this hospital has the specific doctor, I don't mind waiting 6 months. That's no longer the case in Portugal. You can get good specialists in different hospitals. If you want the service tomorrow, you can get it. If you want to choose the hospital that has a certain equipment, you can do it. So that freedom of choice helped a lot to improve the service, and are things that you see with language barriers, with assistance to people with difficulties in moving. So all of the hospitals, especially the private, the public, are slower to move in that sense, but the private moved in that direction of, okay, we need to provide a very good service in order to differentiate, and people choose us when they need, because it's not, healthcare has that problem, is that I cannot create demand. Demand happens naturally. I only have to be, and this only is a major thing, we have to be the first choice when people think, okay, I need a consultation and I had a good experience in another specialty or doing a lab test or whatever, and I'm going to choose these guys because I enjoyed the experience and the service they provided. So you have a lot of care dedicated to making the hospitals very user friendly and very, very service driven.
And also not super expensive as they are in the United States of America.
Yes, so, that's one of the shocks that our investors had, because the private is the main difference is that the U.S. system, in simple terms, it's a purely private system, and it's a system that has very few checks and balances in terms of how the system works, meaning that it's a cat and mouse game where the insurance tries to squeeze the prices, the hospitals get creative and increase the prices in a different way, then the insurance responds to that, and so on. So it's kind of a back and forth and a spiral in terms of costs for the patient. In Portugal, the existence of the public system is one of the main things that keeps the system balanced, meaning that we have transparency on how much does something cost, whether it's a consultation, a hip replacement, whatever. So you know that, okay, a hip replacement in the public costs X. If a private hospital tries to charge an insurance company 2 times X, they would say, okay, you need to have a very good reason to do that. So the prices don't get out of control, and the system has also something that's very important, which is the healthcare insurance is very affordable, and this is one of the reasons. This is all interconnected, but it's one of the reasons why we have such a significant weight of private hospitals, because several years ago, around 20 years ago, insurance companies in Portugal would sell expensive insurance to wealthy people, so they have few clients but very, very profitable. At some point they saw an opportunity and said, okay, we're going to start selling affordable insurance to the middle class. We just need to create a system where the consumption does not impact our profitability. So what they did was they created insurance that's relatively inexpensive. They control the consumption by having co-payments that vary according to your consumption. And it's something that kept the system quite balanced, meaning that the insurance companies make money, the hospitals make money, no one makes an absurd amount of money. So no one takes a bigger piece of the pie. It's balanced. Of course, there are negotiations. Insurance try to lower the costs. The hospitals try to charge a little bit more, but it's in between certain boundaries of rationality.
Yeah, do we know more or less how much those costs are? Because I mean, obviously it varies from
I usually give my personal example. I don't mind doing it, but just to give a sense, and I know the prices in the US. But for example, we're a family. I have a family of 4, so 2 adults and 2 children, 2 teenagers. I hope they don't hear me say that. So 2 teenagers, and we pay for a relatively good insurance. We pay around 250 euros per month.
That's exactly what we pay as well. So we're a family.
It's around 3,000 euros a year, and we are and people always ask, but okay, what type of coverage do you have? And I have coverage for anything at the outpatient level, meaning that my limit can go. I could do something like 70 consultations and still be okay. it covers in terms of surgeries and inpatient care, it covers anything that would be expectable for my age, meaning that if I need a hip replacement or if I fall and break my knee, it's perfectly covered, no issue. Of course, it's an insurance that you say, okay, but if you go for complex problems like oncology and you need very expensive treatments, you need a more expensive insurance, but still you get insurance, very good insurances for a little bit of additional cost, not that
and
much.
obviously it goes without saying, for those people out there who may be a little bit older or have more intricate problems, then the price is obviously going to go a little bit higher, right?
No, of course, it's something that it gets more expensive. Sometimes it gets a little bit trickier to get the insurance because of pre-existing conditions. And the insurance, the reason why they have affordable insurance is also because they have good clinical teams trying to figure out where the risk is, and that's normal. But you can still get insurance. You may get a limit in terms of the duration of the insurance if you're above a certain age. But apart from that, you have the pre-existing conditions which play a role. What's important here, it's also something that I usually tell people, is that even for older people, if you think on the price of the private healthcare, of the private hospitals, the price that we call purely private, meaning that you pay out of pocket in cash to the hospital without any involvement of an insurance company, it's still very affordable. Because I can give you an example. I heard tons of examples when I spoke with US investors, is that, for example, if you need to go to the emergency care here, and we are not talking about trauma or an accident, you're feeling ill and you go to the emergency, get a non-scheduled appointment, do some lab tests and an x-ray. Here, purely private, meaning paying out of pocket, you're probably talking about 150, 200 euros tops. In the US, we are talking about thousands, meaning that you probably, I've seen many examples of $1,500 for one consultation and one x-ray, so that type of thing. So here, even if you don't have insurance, it's not, in Portugal, it's technically impossible to go bankrupt on healthcare, because even if you use up your insurance limit, you have the private hospitals have articulation with the public in some cases where you know that the patient is going to exhaust the limit, is going to use up the limit of the insurance. You start to plan on what you're going to do in terms of if he needs to be maintained at the hospital in a bed. You try to manage that in order for them to not suffer any issue of, okay, the money is spent, you no longer have any limits to use, so we're not going to send you out. We understand that you need care, and we're going to try to figure a way to do it.
Yeah, and just to add to that as well, I mean, if you do have insurance like we do, whenever we go and have a doctor's visit, it's about $40. So that brings it down.
With insurance, the co-payments are relatively light. They're percentage-wise, they are a little heavier on consultations and lab tests and imaging. For heavier things like surgery, inpatient, more invasive exams, you pay a relatively small co-payment.
And do you prefer any insurance?
You also have also have something that's been growing in Portugal, especially with foreigners coming in, is that you also have international insurance companies that provide a very good service. Of course, we are talking about different costs in terms of insurance, but they give you a very good coverage. And I would say that the top insurance companies, I'm not going to mention names, but everybody knows them, they all have established, in most cases, agreements, especially with the largest groups. They have established agreements where you don't have to pay and then get reimbursed. You already get the price already calculated, so you don't have that much cash flow going into the hospital and then waiting for them to pay you back. So you also have that going.
And obviously, with any insurance companies, do you prefer working with any insurance companies and sort of suggest any over the other, or does it just
No, in Portugal, the
agnostic?
market has you don't have that type of closed networks because we are small. So we have 10 million people right now. We have around 5 million people insured, even though you have universal access to the public, but you have 5 million people with some type of insurance. But even with those numbers, you have probably 3 insurance companies that dominate the market. They have, between the 3 of them, they have around 70% of the market. So you have to work with everybody. But it's not the case that if you have an insurance, you cannot go to a specific hospital. Usually, if you have an insurance, every single hospital has an agreement with that insurance. Mm-hmm. With clinics, sometimes they don't because the doctors don't want to have. But with hospitals, if you have insurance A, you can go to all the hospitals in the country. Insurance B, the same, and the hospitals don't do any type of selection. It's because the prices are also very balanced. The insurance companies get almost the same prices across the board. So for us, it's a little bit the same.
Excellent. So if people, because often we speak to a lot of people before they move over and they have certain pre-existing conditions which they need certain drugs for. Is there anywhere they can go for advice about their problems and availability of certain drugs in Portugal, etc., before they arrive here, like getting online with a video call or just a chat line?
I would say that the easier way or the easier approach to do that is to have a specific consultation. If you ask me, okay, what should be the specialty? It depends a little bit on the problem. You have things that are specific from cardiology, and it's easier or it's more efficient to talk to a cardiologist. But if you have something like someone that has several pathologies, diabetes, some cardiac problem, but also respiratory problem, it's always easier to work with internal medicine because they can look at the case from a broad perspective and can help you plan for how to manage. In terms of drugs, we usually don't have any issue in terms of supply chain. You might have some shortages here and there, but it's relatively rare. And you can get the treatments, and also the doctors can help you kind of plan on what's the best way to do it, because sometimes you have treatments that are easier to go through the public route. Because, for example, I know this example because it's quite close to me. I have someone who is followed in the private, but it's also she's also followed in the public, because the way to get a specific treatment, it's much easier in the public. It's because it's a system it's a system that's already in place. It works very well. So, and doctors know how to navigate this context.
Okay. Is there like a call line or a hotline or something that you can call up at hospital or and ask these questions, or is it mainly with the insurance companies?
If you search through the private hospitals, you always have the ability to schedule video consultations with several specialties. You need to provide information, also give some context of what's the consultation about, but you can usually do that. So it's relatively easy, and most of the players have it available to the general public. You'll have to pay one consultation, but it's something that it's not that. Even in some cases, video consultations are slightly less expensive, but it's something that it's quite easily attainable, because before COVID, you already have this online movement. With COVID, it became ubiquitous. You have it everywhere.
That's great, because I think that'll help a lot of people before they move over, because they have some pressing questions, I think. And
no, of course.
Just quickly about operations and surgeries, do you have any sort of rough costings for that? I know the insurance would obviously bounce that off.
No,
is that a difficult question?
It's a difficult question because surgeries are always always have a coefficient of variability that's quite high. But I would say that there are a few examples that are easier to. I don't know if people are familiar with what would cost, but you have you always have a difference between insurance and out of pocket. So out of pocket is more expensive. But I would go into out of pocket because it's easier than the prices of the insurance to give you a number. But for example, something that it's quite common, cataract surgery in ophthalmology is something that there's a huge demand on the private because there are significant waiting lists in the public. It's something that it's low complexity also and has, I would say, small variability, but some variability, but very relatively small. And we are talking about something that usually costs, I would say, probably purely private out of pocket. You can be looking at 2.5 thousand, 3,000 euros. But that's it. So it's not
for both eyes.
For one eye.
Oh, for one eye. Okay. Yeah.
We usually do one at a time.
Okay. Otherwise, you got a problem seeing
the patient. Yeah. But
okay.
but you have. I could give you an example. For example, a hip replacement. You're probably talking about purely private. It can range from 10, 12 to 15,000. So it's not something. Like I said, it's not something that will make you go bankrupt. And of course, if you're older, there are higher risks that some complication come up and you need to stay at the hospital a few more days. That will make the check grow. But again, it's not something. One additional day in a hospital, it's probably 400 euros.
That's top. Amazing.
So
I was in Puerto Rico. I was in Dominican Republic, and they wanted to charge $3,000 for one night.
So exactly, it's not unless you have some special need, like you need to go into an ICU. That those are different settings. But normal inpatient, if you need one additional day, it goes 400, 500, and this is purely private, not even with insurance. With insurance, is much less.
Well, that's excellent, George. Thank you. Yeah, and just one question about emergencies. So, if, for example, God forbid, you fall down, break your hip in the middle of Faro or something, and they call a hospital, what's going to happen? Somebody's going to call 112. What's going to happen?
What you have two. The system is simple. So, if you have there is a very simple rule in Portugal is if you're transported by an ambulance, meaning that if you get run over by a car, an ambulance comes from the emergency services and takes you, they have to take you to a public hospital. They cannot take you to a private hospital even if you ask. So if you have a car accident, if you fall down on the street and break your leg and you need an ambulance, you'll end up in a public hospital, in an emergency department of a public hospital. To go into the private, and the private does not. Well, they have emergency care. We cannot call it that because of a specific rule, but usually have large hospitals in Lisbon and Porto have emergency care that it's comparable to the public hospitals. In Algarve, in other cities, you have emergency care that goes up to a certain point in terms of care, meaning that they usually, if it's out of their control or out of their capacity at that point, they stabilize the patient and they find a solution for the patient. But you can go to a private hospital if you go yourself, meaning that if you have an accident and someone takes you by car, you can go to the private hospital. You'll get there, you show your insurance, or you'll be informed of how much will be the treatment, and things move on. But if you go through ambulance, you always end up in the public, and you can wait a little bit longer or less depending on how the demand is at that point. But usually, if you come by ambulance, you have priority. So, no. In Portugal, there are specific rules for waiting times in emergency departments above a certain level of urgency. So we have a triage system where if you're above a certain level, you can only wait 1 hour. If it's above a certain hour, it's just 10 minutes. So it's balanced. So if you really need the care, you won't be left out.
Okay, excellent. Okay, and then just to finish up, can you just tell us a little bit about the group? Because I know that you guys have got clinics or hospitals in Olhão and Vila Moura as well. Is that correct?
So in Algarve, so we have one hospital which is the backbone or the hub of the group, which is in Lolé. So this is for Portuguese terms, it's what we call a mid-sized to large-sized hospital that has the full range of services, meaning we have from consultations to non-scheduled consultations, emergency department that provides care up to a certain level, all the diagnostics, imaging, lab tests, endoscopic exams, specialty exams. We have 2 operating rooms and that provide ambulatory surgery and inpatient surgery, and then we have inpatient care. So kind of the full range of what you get at this type of hospital. What do we don't have? If we want, we don't have high complexity surgery like cardiothoracic surgery, which is usually reserved for very specific hospitals. But in terms of surgery, we provide anything from hip replacement, knee replacements, cataracts, hernia, the normal things you would see in such a hospital. You have a multidisciplinary team that also provides a very good care in terms of following up someone that needs to go multi-specialty, has different consultations in several specialties. We tend to have a good approach because we like to have the patient has one physician that has the connection with him or her and kind of directs them to, okay, you probably need to go to cardiology and do this exam. Let's take care of that. But you always have one point of contact with a strong general medicine or internal medicine team that follows you when you have a more complex case, whether it's chronic illness or multi-illness cases. We have that, which is an approach that works very well because people tend to get lost in the system. Okay, I went to the cardiologist, then he told me that I need to go to the pulmonology department, but now I'm left out because the cardiology is just doing the cardiology part. I go to the pulmonology, then he told me something that I need to say to the cardiology. So if you don't have this one-to-one point of contact that sees the whole picture, it can become a little bit confusing. Then the hospital has 4 satellite clinics, if you want, that are very focused on ambulatory care. And all of them, they have different sizes, but what you usually have is you have the consultations. You have non-scheduled consultations, meaning that, okay, I'm not feeling very well. I can go there, and there's a doctor there and a nurse that can look, analyze, and do some diagnostics and say, okay, you need to do this medication, or you need to rest, or you need to go to a hospital. So you have that type of first respondent type of approach, and you have diagnostics, meaning lab tests, imaging services, less invasive exams. So EKG, ophthalmology exams. So the type of thing that kind of provides you a more proximity approach to you. And we have 4 units: one in Olhão, the other one in Vila Moura, one in Tavira, and the one in Almancil.
Okay, and the one in Tavira, is that relatively new?
Yes, it's the most, well, it's not the most recent one because we open a very small clinic. I was forgetting that one. We opened 2 months ago. We opened a very small clinic in Lolé, so in the place where we have the hospital. But it was something that it was done thinking specifically on an area that people are looking for right now in Portugal, which is the GPs, the general practitioners. They were inside the hospital. We built this clinic, or we developed this clinic in order to kind of put them there to be something more related with the family doctor and to follow up families, and also have some lab tests that are in a more I would say, quiet environment than the hospital. So it's something that it's more driven, it's more targeted at families. It's working very well. It's quite small, but it's quite comfortable clinic, and it's the most recent. But Tavira is the second. The second youngest in the group. It's interesting
for a long
because
time, Tavira, there wasn't much in Tavira, was there?
No, there wasn't much, and we have the clinic is interesting because it's in a very good place. It's inside a shopping mall, although people usually tend to look at that a little bit on the with a bad lens. But it's good because you have very good access in terms of parking. The clinic is very well located inside the shopping. It has very good accessibility from the shopping mall, and it was designed to be a very high-end clinic in terms of service and in terms of facilities, and it provides a very good service in terms of having doctors available. So we get a lot of demand of people that come up that come to the clinic without any scheduling done. So just, okay, I need to see a doctor or I need to see a nurse, and then you do the exams, you get a diagnostic, and hopefully you get treated, or you get directed into a hospital if needed. And then you have a set of specialties from orthopedics, ophthalmology, cardiology, and so on, that you can have there. We are going to start expanding this clinic this year to have imaging services. Right now we only have ultrasounds, and we're going to have a more diverse, meaning that we're going to have heavy imaging, meaning MRI, CT scan, and so on, but also inside the shopping, inside of the shopping mall.
And what about other future plans around?
So what we are looking for, and also after we acquired the hospital. So the hospital already had expansion plans. We are kind of speeding up a little bit. The hospital itself has expanded recently. It's an expansion that's not very visible, because we replaced the service inside the hospital that was from an external player. We took it out. The contract ended, and we expanded the number of beds we had available, but it's a small number of beds. The hospital also has an expansion plan. It's roughly 30% more capacity, but it's across the board. So we are having more consultation offices, more beds, and more exams and treatments available.
Does that mean you're physically expanding in Lolé?
So we're physically expanding the hospital. It's something that we are still working on the project. I would say it's with the time that these things usually take, probably by the end of next year, we will be opening, and we are looking into two additional locations in the Algarve region to have this type of satellite clinic. So we are broadening the space that we are covering, always having the backup of the hospital, meaning that we can refer patients to the hospital when they need it, but still have that proximity and that easy access with a good service available to people living in cities nearby.
Soon you're going to have to change the name from Lolé Hospital Group to Algarve Hospital Group. Yeah.
No, it's interesting because brand-wise, it was a good move for when the hospital was created, because since there is no hospital in Lolé, they were able to register the brand of Hospital of Lolé, and they don't need to mention that it's private. So it's the only hospital in Lolé, which makes it easier to locate. And but it's been the interest that our fund got in this group was mostly driven by that. Was that in Algarve you end up having we are not the only players in Algarve. We are not even the largest players in Algarve. By far, you have a larger group that's the fifth or the sixth largest group in the country operating in Algarve, but it's something that Lolé made different, or that they had a different approach. Is that they always focused more on service and not on volume. The other player is much larger, but you go to the hospitals, it's much more of a mass market, if you can call it that, hospital with large waiting rooms, lots of people, but lots of doctors and lots of things happening. I don't like to call it a boutique hospital that doesn't exist, but it's Lole. It's a lot of the focus is that, and the example is, for example, Philippe, who is in charge of the hospital and is responsible for the day-to-day management of the hospital, is obsessed with that, and it's something that we find very interesting and very useful and very good for a unit like this, that they cannot compete with the largest player in the market, but they are taking a part of the market that wants a better service, and this obsession from him, you see it in I have a lot of, sorry, my dog is
It's okay. He's telling us the time's up.
we see it in lots of different situations where Philippe is the guy who goes to the receptionist and asks her why isn't she smiling, or why she. I remember that one of the first time, I don't know if it was the first time or the second time I met Philippe, and we were in, it was COVID time, so not the initial chaotic, but 2021 with lockdown happening and so on, and there was a change in the rules to get back to the UK. So there was a change in terms of tests, that you needed to provide a certain test, a PCR test, when you enter the country coming from Portugal. And it was summer, so there was a huge queue that came out of the hospital into the street, and we left the Philippe's office, and we left, and he suddenly saw the queue and said, "You need," and he was with us. He was showing us some parts of the hospital. Said, "You need to wait 15 minutes, so because this is unacceptable. I cannot have people waiting in the sun under 35 degrees." And he went there, and 20 minutes later, he kind of moved everything around and everything, because he said, we cannot have people waiting in the sun, because that's not what we stand for. And you have that example. You have a lot of examples. There was one that we were on the phone, and he suddenly stopped me and said, "Just give me 1 minute." And he came back and he told me, "Yeah, we have a van that has our brand, has the brand of the hospital. It's a van that we use to transport materials through the clinics, and it just passed by, and the van was dirty, and we cannot have our brand associated with that, because that's not the service we provide." So you have a very close attention to the detail. You have a very close, since you enter the door, or even before that, through the phone, and you have that focus on, okay, the patient is in a situation that has special needs, the health is not at the level that it should be, so everything is moved around that to provide a very good service and with good results. And you also have the doctors and the technology, but that's kind of accessory to what you're doing.
Well, I know, because I've used Lule Hospital many times over the last 10 years, 15 years, so yeah, I can vouch for that. It's great. But George, thanks so much. It really was interesting talking about the health systems in Portugal, and in particular Lule Hospital. And I just want to wish you all the very best, and thank you so much for coming on and sharing your stories.
We also thank you to have the opportunity to show a little bit what we are doing, how the system works. It's for U.S. citizens. It's always something that it's not easy to understand at first, because it's a very different system. But again, it's something. You mentioned something in the beginning, which is, I think it's the best way to describe it, is that you kind of have the best of both worlds, meaning that you can use the private for your day-to-day healthcare needs, or getting followed up, or having your consultation. You can also use it in times of more emergency care. But if you have things that are really complex or life-threatening, you always have the public to provide that service. That it's there, it's universal access. So you don't, as whether it's a U.S. citizen or any other country, if you have life-threatening or something, you don't have the issue, the financial issue of, okay, are they providing care? Do I have money for them to provide care? So you usually don't have that. It's not how the system works. It's, if you ask me, okay, that makes the system slightly expensive. Yes, it does. It comes out of my taxes and everybody else's taxes, but you cannot have one thing without the other. But it's something that you don't have. You understand there's a financial burden in everybody to have the system working, but you don't have the bankruptcy risk or the financial extreme event risk of having a problem and suddenly you need to choose whether you keep part of your money or you become healthier and lose the money. So it's something that it's interesting and it's unique about the Portuguese system.
Yeah, absolutely. Great. Well, George, I'll let you go and take your dog for a walk because it sounds like he wants to go. But thanks so much. I really appreciate it. And
okay,
we'll speak to you soon.
It was very nice to meet you. Thank you.
AlgarveAddicts.com. We'll see you next week. But if you need any help relocating to the Algarve, click through to our website, AlgarveAddicts.com. We offer tours, immigration assistance, long-term rentals, and we can buy your house.